Hello everyone, I am Dr. Mridula, Consultant Neurophysician at Pratima Hospital, Kachiguda. Today, September 21st is being celebrated as World Alzheimer's Day. It is an international campaign to raise about the awareness of the disease. So today I am going to discuss about the Alzheimer's disease and dementia. Dementia is not a part of the normal aging. It is because of the brain cell death and its intercell communication, resulting in problems with thinking, feelings and emotions. There are many types of dementia. Most common of it is the Alzheimer's disease, which accounts for 60 to 80% of the disease. Every year, 6 million of people are being diagnosed with Alzheimer's disease worldwide, and this number is continuously increasing annually. Someone around the world is being diagnosed with the Alzheimer's disease every 3 seconds. Alzheimer's is a severe neurodegenerative disorder because of the accumulation of the abnormal beta amyloid protein within the brain, causing the neuronal and the synaptic loss. This causes memory loss, affecting the day-to-day life activities, and this also causes confusion, disorientation, behavioral changes. Eventually, the patient develops difficulty with walking, swallowing, and difficulty with speaking. It is most commonly seen in the elderly age group, 65 years or above. But however, recently 5% of the cases are seen even in the early onset, that is between 40 to 50 years. Though age is the major risk factor, it is a non-modifiable risk factor. And the other non-modifiable risk factors are family history, genetical history, etc. This year theme is never too late, never too early. The main aim is focused on identifying the risk factors, early identification of the risk factors and adopting the risk reduction, thereby to prevent and delay the onset of the Alzheimer's dementia. So, the 12 risk factors which are identified: smoking, excessive alcohol consumption, diabetes, hypertension, obesity, physical inactivity, air pollution, head trauma, hearing loss, social isolation, less education and depression. These are the 12 factors which are identified as a modifiable factors in the Alzheimer's disease. So, coming to the risk reduction, for diabetes and hypertension, we need to monitor the sugars and blood pressure, take the regular medication and follow the advised diet, and avoid the alcohol consumption, avoid smoking. For obesity, you need to have adopt the healthy diet, avoid the junk food, and for physical inactivity, incorporate the aerobic activities, at least 150 minutes in a week of moderate aerobic activity, or 75 minutes of vigorous aerobic activity per week is recommended. Coming to social isolation, depression and less education, you need to involve in active learning, puzzle solving, become a club member and engage yourself in the social activities will all promote the good brain health. In case of hearing loss, use the hearing aid. So with all these risk reduction, 50% of the cases can be prevented or delayed. Coming to the warning signs of the dementia: memory problems, disoriented to the time and place, problem with language, challenges in understanding the visual and the spatial information, difficulty in performing the familiar tasks, difficulty in keeping track of the things and misplacing the things, poor or decreased judgment, behavioral changes or mood changes, or withdrawal from the work or the social activities. Whenever you find any of these signs in your family member, it is a high time to consult the doctor. Dementia has no permanent cure. It is a progressive disease. So early identification of any signs and treatment helps in reducing the symptoms and improving the quality of the life. Thus, finally, early identification of the risk factors and adopting the risk reduction measures will prevent and delay the onset of the dementia, and identifying the warning signs early, diagnosing them and treating them will help in reducing the symptoms and improving the quality of the life. To conclude, let us celebrate this World Alzheimer's Day by increasing the awareness about the disease and making this world a better place for the people suffering with this disease. Thank you.